Have you ever had that nagging stomach pain that just won't go away? Or maybe you feel bloated and nauseous for no reason? Well, there's a tiny, hidden culprit that might be behind it all. It's a bacteria that could be living in your stomach right now. And over half the world's population has it, most without ever knowing. Today, we're pulling back the curtain on Helicobacter pylori, or H. pylori, the secret troublemaker behind many stomach issues. So, what exactly is H. pylori? Simply put, it's a spiral-shaped bacterium that has a unique talent for surviving in the harsh, acidic environment of your stomach. While most germs get destroyed by stomach acid, H. pylori is a master of disguise. It burrows into the protective mucus lining of your stomach wall, where it can live for years, or even decades. This infection is incredibly common, affecting billions of people worldwide. How does it even get there in the first place? H. pylori spreads through a few main routes. The most common is through contaminated food or water. Think of places with less than ideal sanitation. It can also spread from person to person through direct contact with saliva or other bodily fluids. This is why practicing good hygiene, like washing your hands thoroughly, is so important. It's often passed within families during childhood and just stays there quietly for years. Once H. pylori sets up camp in your stomach, it starts to cause trouble. To protect itself from stomach acid, it produces an enzyme called urus, which neutralizes the acid around it. This lets it thrive. As it multiplies, it damages the stomach's protective lining. This irritation leads to inflammation, a condition known as gastritis. Imagine it like a constant low-grade sunburn on the inside of your stomach. Over time, this chronic inflammation can wear down the lining so much that it causes painful open sores, which we know as peptic ulcers. Now, many people with H. pylori have no symptoms at all, but for others, the signs can be quite uncomfortable. Common symptoms include a dull or burning pain in your stomach, especially when it's empty, feeling bloated, burping a lot, losing your appetite, or feeling nauseous. You might also feel full after eating just a small amount of food. There are also more serious warning signs that you should never ignore. If you experience severe stomach pain, see black tarry, stools or vomit blood or something that looks like coffee grounds, you need to see a doctor immediately. These could be signs of a bleeding ulcer, which is a medical emergency. Left untreated, a long-term H. pylori infection can lead to serious complications. We already mentioned peptic ulcers, which can cause significant pain and bleeding. This slow, chronic bleeding can also lead to anemia, making you feel tired and weak. And while it's rare, a chronic H. pylori infection is a major risk factor for developing stomach cancer later in life. That's why getting it diagnosed and treated is so important. So how do doctors find this sneaky bacteria? Thankfully, the tests are pretty straightforward. The most common and reliable are the stool antigen test, which looks for H. pylori proteins in your stool, and the urea breath test, where you drink a special liquid and your breath is analyzed. There's also a blood test, but it can only show if you've been exposed in the past, not if you have an active infection right now. In some cases, a doctor might recommend an endoscopy, where a tiny camera is used to look directly at your stomach lining and take a small sample for testing. If you are diagnosed, the treatment is very effective. It usually involves a combination of 2 or more antibiotics to kill the bacteria, plus a medicine to reduce your stomach acid, which helps the lining heal. This is often called triple therapy or quadruple therapy. It is absolutely crucial to take all of your medication exactly as prescribed and to finish the entire course, even if you start feeling better. Stopping early is a big mistake, as it can allow the strongest bacteria to survive and become resistant to antibiotics, making the infection much harder to treat later. Of course, prevention is always best. The key is good hygiene. Always wash your hands with soap and water after using the bathroom and before preparing or eating food. Make sure you drink clean, safe water and eat food that has been handled and cooked properly. To wrap it all up, H. pylori is a common stomach bacteria that can cause gastritis, ulcers, and other problems if left untreated. If you're having persistent stomach pain, bloating, or nausea, don't just ignore it. Talk to your doctor to see if you should be tested. Getting diagnosed and treated can prevent serious complications down the road. Thanks for watching. If you found this explanation helpful, consider subscribing for more simple medical videos that actually make sense. See you in the next one.